Hello, everyone. I'm Jeffrey Walt, Editor-in-Chief of Chain Drug Review and Mass Market Retailers. Welcome to a special edition of our video forum. Today, we're here to recognize the National Association of Chain Drugstores as Chain Drug Review's Retailer of the Year. I recently talked with three of the association's leaders, current NACDS Chair Colleen Lindholz, who is also President of Kroger Health, her predecessor at NACDS, Rick Keyes, who is CEO and President of Meijer Inc., and NACDS President and CEO Steve Anderson. We discussed some of the factors that make the organization so successful. At first glance, Retailer of the Year might seem an odd designation for an association, but it should be remembered that NACDS is an organization comprised of retailers who, Colleen Lindholz reminds us, are deeply committed both to the association and to the industry as a whole.
I think this is an important message for retailers and suppliers just across the country to understand that the importance of the engagement of the industry leaders inside of NACDS is, I think, very unique and very strong. And, during the pandemic, it's what was needed for us to come together with NACDS and their leaders and really talk about focusing on the true needs at that very moment and then going out and making things happen quickly.
NACDS has in recent years evolved along with chain pharmacy and in the process made policymakers and payers more aware of the industry's contributions. Steve Anderson talks about that journey.
I think back of, where we started like 14 years ago when we were talking about pharmacies as the face of neighborhood healthcare and how far we have come from that point to where we are now, where currently 70 to 80% of all COVID shots are being administered in a retail pharmacy. And I remember being on Capitol Hill shortly after I came to NACDS, and I was telling them, about NACDS and how we should be the centerpiece of healthcare in this country, and they really, frankly, didn't really think that we were part of the healthcare system. We thought we were just retailers that sold various products, including pharmaceutical products.
Chain pharmacy has been asked to play a central role in America's ongoing battle against COVID. Rick Keyes, who was NACDS chairman at the time the pandemic started, recalls NACDS efforts to help the industry ramp up its response to the pandemic.
When COVID first hit, there was so much uncertainty. And so as we thought about NACDS, we needed to move pretty quickly because we knew we were on the front lines. And whether it was our retail stores or our pharmacies, we knew we could help and we knew we could make a difference. And there was a lot to be sorted out. So we moved really quickly to work both at the state level and the federal level through the amazing staff at NACDS and our board to say, how can we help? What are the things that we can do as retail pharmacies to really support our communities? How do we mobilize our pharmacy teams? How do we get on the front lines and really make sure that we can provide access to testing, to take care of and support our communities?
Lindholz assesses chain pharmacy's achievements in combating COVID, what that tells us about the industry, and lessons for NACDS and its members.
From the rollout of testing to the rollout of the vaccinations, the retail industry has truly helped save our country. Truly helped save lives in this country, and I'm so proud of that. And I think from a lessons perspective and things that that we have that we really think about, what have we learned during this? I think one is just the validation of where retail pharmacy and the industry sits in the whole ecosystem of healthcare and just the importance that we play in healthcare overall. If you think about the accessibility, convenience, affordable, efficient, and then having some of the most trusted healthcare professionals in the United States. And then from an NACDS perspective, lessons learned during the pandemic. One, I think, is just the role that NACDS plays as the storyteller of the industry and the advocate of the industry. They early or during the pandemic, the public policies that were really needed were not in place to allow retail pharmacies to really respond like we did. And NACDS really did step up and advocate early on to allow that to happen and put those policies in place that, like I said, allowed us to see the results, the country to see the results that they see today.
During the past 2 years, NACDS has raised the profile of retail pharmacy in a variety of ways, including television spots. I asked Keyes about the genesis of that campaign.
During the pandemic, especially early on, it was clear that we needed to have a voice, and not just in the industry, but in the country. You think about the role of the pharmacist being one of the most trusted advisors in the healthcare system, and that voice needed to be heard, and we needed to share that voice. And so I think, our pharmacy team stepped up. I think we put together some really amazing spots that we put out there across the country that really talked about, we're ready now. Pharmacy is ready. We're here to support you. Come get tested, come get vaccinated. And I think that played a critical role. And to know that is there, that the pharmacists are ready, and we're going to be part of the solution, I think was very helpful.
All the attention on the pandemic has not prevented NACDS from making progress on other important issues at both the state and federal levels. Anderson recounts some of those victories.
We're optimistic, going into next year. Throughout this year, we've had, I guess now 70 advancements to make flexibilities permanent for immunization, testing, and pharmacy and technician scope of practice. So we have achieved advancements to create PBM reform and transparency to include open networks, prohibitions on gag clauses, any willing provider provisions, specialty medications at retail and reimbursement policies, and pharmacy audits, and all those we've done in 15 states. One of the other issues that came out, and it surprised a lot of us, frankly, who we thought it would be handed down maybe in 2021, but the U.S. Supreme Court ruled unanimously in the Rutledge decision, which was handed down December 10th of 2020. And that has allowed us to do more on PBM transparency and PBM practices. And this last year, we've had more than 300 PBM bills that have been introduced. And I guess the number right now is 53 new laws have been enacted, which I think is a great victory for our members on a lot of different fronts. So we're continuing those fights, and we're going to continue to tell the pharmacy stories at the state level, in addition to the national.
Keyes makes clear what the stakes are for pharmacy in both the legislative and legal arenas.
We've seen a record number of pharmacies that have closed, and this reimbursement issue is not going away. It's just getting worse. And so what we've gotten tremendous traction. I know we've seen it in the 6 states where we operate, where states like Indiana, where we're actually able to pass state legislation that calls for transparent reimbursement rates, and we see movement in that regard.
One of NACDS' most important functions is facilitating communication and interaction among business partners. Anderson discusses the association's proven ability to nurture those vital relationships.
One of our associate members told me early in the pandemic, when we couldn't get together for our meetings last year, he said, NACDS is really the glue that's keeping this industry together. And I think that's true. The great strength of NACDS is the relationships. And I hear that whenever I meet with a member, it seems. Nobody does that better than NACDS at our meetings and our conferences that we have. And we're looking forward to getting back to that, because we have a lot to talk about in terms of what we're going to be doing to move this industry and this association forward. And our members are so passionate about what they do for the American people, and that makes it enjoyable and beneficial for all of us to be involved in those events. So but that communication that we have between our chain retail members and our associate supplier members is invaluable in terms of what it does for our member companies and the consumers that come into our stores each and every day.
The growth of chain pharmacies' reach in healthcare has prompted NACDS to take a new look at its members' needs and how they can be met. Lindholz talks about NACDS's strategic vision for the future.
before. Steve and I have talked a number of times about the overall strategic roadmap for NACDS and how we're moving towards more of a health and wellness sort of holistic solutions around helping people. You know, us being the front door of healthcare, there's just this huge opportunity for us to not only expansion of scope, but just to understand with the consumerism of healthcare and things like that, how we can provide more products and, you know, services when people need it the most. And as you start to see, you know, retail have not only pharmacies, but clinics, you know, how can we come together in ways like never before?
Anderson says that he is confident that NACDS has the capabilities to do whatever is needed to assist its members in answering the question raised by Lindholz.
I think that everything that our members are doing now in positioning themselves, which they have been for quite a while, in terms of health and wellness destinations, I think is striking. And you know, NACDS in 23 will be celebrating our 90th anniversary, and I think that coming out of this pandemic, we'll have a new birth in terms of innovation and transformation and technology and really leadership in terms of where the industry is going to be going as we come out of the pandemic and where NACDS should go. So I think we have a tremendous opportunity to really lean into these innovations and transformations that are underway. And I think the dramatic shift in what our member companies are doing to become these health and wellness destinations is striking, and NACDS needs to do the same, and we intend to. So watch this space. I think there's going to be a lot of things that are going to be very exciting that our members in the industry are really going to enjoy moving forward. So we've got a lot of work to do coming out of this pandemic, and we're up to the challenge.